The importance of the alliance in the open setting is to allow the patient to show the behaviors for the things that they came here to work on, but also to be able to talk about them and not just act on them. And the patient has to trust that you will be able to work with them around that, that you'll take them seriously, that you'll explore this with them and try to find meaning. And, based in the alliance, you help to discover meaning about behavior. And that's one of the things that I think we do here very well, is to take an action and to think about it not just as action, but to think about it in a way as a statement. And the process of translating that statement and translating that behavior into a meaningful sort of dialogue between two people can't happen unless you have a relationship with that person. Because the person's, first off, not going to want to tell you about what's happening. Second, they're not going to want to hear your sense of what's happening. And often people will try to simplify it to, well, I just did this thing and it doesn't have any meaning and it's out of context, it doesn't make a difference. I won't do it again. And so slowing it down and believing in this process in a way that will unfold something that will allow you to get into something that's more of a core issue for this person as to, so why are you continuing to act out? What's leading you to believe that you can do these things and there be no consequences? How has this affected your life? Because the reality is that patients who come here have ended up in a place where they can't manage their lives and they need help in figuring that out and getting back on track. And that's embedded in developing a relationship with not only the therapist, but with all phases and all individuals here that work with the patient.